Jordan?
Good evening, everyone. On behalf of A4M, thank you for participating in this webinar on how to transform your practice with Dr. Pamela Smith. This webinar is meant to be interactive and to help answer any questions, so please feel free to ask Dr. Smith any questions you may have pertaining to the topic. Dr. Smith is an internationally known speaker and author on the subject of metabolic, anti-aging, and functional medicine. She is currently the director of the Center for Healthy Living and Longevity and the founder and director of the Fellowship in Metabolic, Anti-Aging, and Functional Medicine. Dr. Smith is also the director of the Master's Program in Metabolic and Nutritional Medicine at USF College of Medicine. Now I'll pass it off to Dr. Smith to begin the webinar.
Good evening, everybody. We do want this to be very interactive tonight, and hence I will stop after every slide so that we can have an interaction. Our goal tonight is to look at how to transition your practice from a conventional medicine practice to a metabolic medicine approach. And we're going to use the word metabolic medicine encompassing the idea of functional medicine, encompassing integrative, and really many other terms, including anti-aging. First of all, a key component is not to mix practices. You want to set up a separate practice if you already have a conventional practice, no matter what field you have specialized in. In the fellowship, we have every single specialty and primary care field represented. We even have a pathologist who last year opened a practice near Muskegon, Michigan, where he sees live patients after going through the fellowship. So even pathology we have represented in the fellowship. What will happen is if you try and mix the two practices, you will not be successful. We've had numerous fellows try and do this. Most recently, I was on with one of you, and I had talked to you about 18 months ago and suggested that you don't take insurance in this new practice, but this person wanted to take insurance, and really, she called me 2 days ago and said, you know what, I shouldn't have taken insurance. I have $250,000 worth of bills that the insurance companies refuse to pay me, and I'm out $250,000. So this is a huge issue. Everybody is up. So we would like to keep everyone unmuted tonight so we could have people ask questions. However, that does mean that if you have outside noises around you, please mute yourself. To go back to where I was, I guess I won't go back to where I was. Jordan, can we mute everyone?
Yep, I'm on it.
Okay.
There you go. Should be good.
Okay, I think what we'll have to do is unmute people as they ask questions.
Okay.
Okay. So we are going to change the format because there are some people that are very noisy. We are going to unmute you as you ask questions, so you will need to let Jordan know when you have a question. Okay? Great. Now, this person is out $250,000 that the insurance companies will not pay them. We have another fellow who absolutely had to take insurance in their practice, had to, and the insurance company disenrolled them. In fact, we've had that happen to many fellows because in this kind of approach, it's personalized medicine. We order a lot of labs, and the insurance companies started disenrolling them because they ordered too many labs. So do yourself a favor. Have one practice for conventional medicine, whether you're a family practitioner, internist, OBGYN, other kind of specialist. Please have two practices. In your second practice, it really behooves you, honestly, not to take insurance. I know that scares many of you, but you can do this. If you see 10 patients in a day and you bill what you should be billing, you will make as much money as if you saw 35 people under insurance constraints, but you'll have more stress seeing the 35 people than the 10, and you will still make the same amount of money. With the Affordable Care Act, this is a real boom for us because many people in the United States will have a $5,000 or $10,000 deductible. Yes, some people will choose to never go to the doctor, and that's unfortunate. But many people will start realizing that they're going to have to pay out of pocket anyway, so why not pay for someone with a personalized medicine approach that we have, where we look at literally how the body works, treat the cause of the problem, not just treat the symptoms, and be proactive. In my own practice yesterday, I had someone come in who saw a, quote, anti-aging doctor in my area who was not fellowship trained. And as I started going through things with this new patient of mine, she realized that, oh my God, no, my doctor didn't do saliva testing. Well, I've been seeing this doctor for 10 years. He didn't tell me my blood sugar was climbing, etc. So people start getting the hint that we're proactive as well. We know 5, 10, or even 15 years before the patient becomes diabetic that they're going to. So we're a proactive patient. We are proactive with our patients. We can look at even not turning on a gene they may have inherited, like diabetes. So don't mix the practices, because if you do, let's say you're an internist, and you start doing all of this and functional medicine tests, etc. in your practice, once you open up a separate practice, they will not all of a sudden start paying you cash with what they got before under insurance guidelines. Also, many of the specialties that you all practice under, really, this is not in that area of specialty. This is a metabolic approach. Yes, measuring vitamin D is in most people's specialty area now, but certainly measuring amino acids, fatty acids, and organic acids is not. So the way I explain to patients is that basically I'm a specialist, and I'm going to measure things that are not traditionally measured by your other doctors. And if you're already a family practitioner, for example, say that on Monday, Wednesdays, and Fridays you're functioning as a family practitioner, you stay in those guidelines, you take insurance in that practice, but on Tuesdays and Thursdays you're functioning as a specialist. You don't take insurance in that practice because it is personalized medicine. That way you can start off still getting paid in your conventional practice until you make the transition. So I'd like to open it up now to questions. On this first slide, do not mix practices, set up a separate practice. Questions? Oh my God. It's terrible. Jordan, can you just unmute one person as they would like to speak?
Yes.
Perfect. Are there any questions, Jordan?
I don't see any, and I sent a message, so anyone who has questions could also enter them via the chat option. So I don't believe we have any at this time.
Okay, perfect. Next slide. Always encourage the patient. Okay? When I see patients, let's face it, you don't want to be Eeyore. Does everybody know who Eeyore is? Okay, and Winnie the Pooh? You don't want to always be a downer. Okay? Let's say the patient came in and they're 50 pounds overweight and their particle size is very small and they're diabetic and they hate to exercise and all those things. Just start with one problem at a time and encourage the patient. Tell them that you're a work in progress. We all are. True story. I always say to my patients, nobody is a nun or a monk. We all cheat on something that we like to eat now and again, etc. So I said this to my husband and wife team in my practice, a lot of my couples I see together. And I said to them, you're not a nun or a monk. Everybody cheats a little bit. Just get back on the wagon for a healthy eating program. And she said to me, oh my God, you don't know, do you? And I said, what? She goes, I used to be a nun and he used to be a monk. So again, encouragement, okay? Have fun with the patient. The patient should be happy when they leave. It should be fun for them, not grueling. My patients, when they leave the practice, they go, oh, it's so good to see you, Dr. Smith. I'm always so happy when I leave here. You want to leave them with the encouragement that whatever we're looking at here is fixable. Even if you're seeing someone for integrative oncology, I have a number of patients in my practice that I see with cancer, but I still leave them with hope. Hope is so important. So encourage the patient. You'll have a much more successful practice this way. Questions?
There is one question I received via email. It's about the legality of having one practice take insurance and the other one does not.
That you'll have to check with a healthcare attorney in your state. The reason is that healthcare is not just federal with Medicare in the United States and Medicaid. It is also state by state and what the insurance regulations are. So what I do suggest is that you check with a healthcare attorney in your own state. We do know nationwide that's never a practice if someone's an ER doctor and then they're starting a practice. Every state, that is not an issue. With some states, there may be some legal issues that you may need to work around, but that is changing in many states with the Affordable Care Act. So check with the healthcare attorney in your state.
Okay, I think that's all we have for now.
Okay, great. It's very important when you look at setting up another practice that you consider overhead and other costs. I've now taught Module 5 28 times. And in 28 times, we've had thousands and thousands and thousands of people take Module 5. Every time I give it, I ask the same question. What does it cost you to run an EKG in your practice? Do you realize no one's ever been able to tell me? I don't know of anybody that runs a business where they don't know what the cost is to provide a benefit or a service in that industry that they're in. Minimize your overhead so that you take the money home. When people ask me how many people are in my practice, I started my practice with myself and a nurse. My nurse was also my receptionist and my office manager. I was a nutritionist. For many, many, many years, it was just she and I. Why would I hire someone else? She could function as her jobs. I could function as mine. Yes, I paid her a little extra to be more than one person, but remember, this is personalized medicine, so you're not going to see 70 people a day. Look at your overhead, minimize your cost. Your overhead in this kind of medicine should never be 50%, never, like it is in a traditional practice. If you're going to branch out into IV therapies or aesthetics or something else, then yes, you're going to have higher overhead, but aesthetics, IV therapies, things of that nature are all cash paying. So you're going to have extra income coming in to pay that extra person. You need to have a base before you start IV therapies, aesthetics, or something else. So keep the overhead minimum. The overhead in my practice is 22%. I take the rest home myself. Doctors are very good at generating income for everyone else, but they forget about themselves. One of you came to me and said, oh, my practice is it's terrible. I'm going to go bankrupt. And that's because you had actually bought a building, renovated the building to the tune of $450,000. You hired a receptionist, an office manager, and a nutritionist and a nurse before you even had one patient in the door. Then if you do that, you have to borrow money to open your practice. I've never borrowed a dime to open my practice. Look at how you can do this. It's personalized. The patient is there to see you. When people ask me, well, how about a saliva testing kit? Who explains to the patient how to do it? I do in my practice. I don't send them off to my nurse. I do it for them. When my patient comes in for the second office visit, I write down in my own handwriting what their therapy should be. Yes, I could spit it out in my computer. I have electronic medical records, but I don't for a reason. I write it down in my own handwriting so that they understand it's for them and them only, personalized, and it's not something that I'm just typing in and generating out of a computer. It's all about the perception that the patient has on how unique their care is. But again, minimize your overhead. There is no reason that a healthcare provider, one person providing specialized medicine, needs 5 people to support them. Okay? Again, if you're going to do IV therapies, aesthetics, and other things, then you may need another person. Also, you can do very well by carrying nutraceuticals in your practice. In one practice in Cincinnati, one doctor, he generates $20,000 every month in nutraceuticals by just what he does by himself. Okay? Some other practitioners generate more. When I was practicing full-time, I didn't carry nutrients in my practice, but I did use other items like Custom Vite, and I got a check every month for $10,000 that came to me. So I made $120K a month extra on just doing a customized vitamin approach. You can do the same thing with Custom Vite, or you can do the same thing by carrying the basic nutrients in your practice. You don't want to carry every single one because they can expire. And you can send people to the compounding pharmacist you work with for the kind of oddball ones you don't use very often. But the ones you use all the time, use that as a vantage point. Same thing with books. I mean, what can you make money on? It's very popular for doctors to sell books in their practice. You get many of the professors, you get our books wholesale. You get mine below wholesale, as do you Laval's, as do Dr. Wilson's books. Charge the patient full price for that. Or what I do in my initial office visit, what I do is I give the patient a book to take home. I build it into the price of the actual visit. And then I carry books myself, Wilson's, Laval's, and other people's. Right in my practice, it's a profit margin center for me. It doesn't cost any money. It doesn't expire. You're getting it wholesale. Just find different ways to do that to add income to your practice. What I do suggest is that you only practice when you're full-time at this kind of medicine 4 days a week. Because 4 days a week, you should be able to generate an adequate income. So I actually pulled up some numbers. If your initial office visit is $595, because this is from our practice, and your follow-up visit is $265, because we raised our prices recently. Comprehensive new patient, $595, follow-up visit, $265. Okay? If you saw patients on average and generated $3,000 a day, which is very easy to do if you're seeing 15 patients a day, you would make, if you worked 40 weeks out of the year, only 40, you would make $480,000. If you're smart, your overhead should be 80 to 100K, and the rest you should be taking home. That's only 4 days a week. That is without IV therapies, without aesthetics, and that is without selling nutrients. That's just office visits and books. So just think about how you're doing this. You do have to run it as a business, but again, typically the average doctor hires 5 people to support that one doc. Not needed particularly when you start out. Questions?
Yes, okay, I got 2 submitted to me. The first one says, where does a health coach fit in this model? When would you personally refer to one or even consider hiring one for your practice?
Great question. Initially, I was the health coach in my practice, okay, because I wanted to take home the money myself. You can do a health coach one of 2 ways. Wait until you can actually afford one, which means that you need to be seeing at least 14 to 15 people a day, 4 days a week, or hire a health coach that already has their own practice that they're bringing in, and then you want to make sure that you're collecting 60% of what they make and they make 40%. That is the usual for a health coach. Okay? Did that answer your question?
Okay, the other one is, when do you suggest we venture out to open a practice? Is it after one completes the program?
Great question. What I do suggest is that you, first of all, start practicing on yourself and relatives. So you start doing some of these tests. And then usually we suggest you consider opening a practice after you've taken 3 of the modules 1 through 5. So at least 3 of them, meaning module 1 is a must. Okay? I really believe module 3 is a must, and module 5. 2 and 4 are really, really important, but do you have to have them to open a practice? No. Do you need them? Absolutely. Do you need 6, 7, and 8? Yes. Because as you go on, you'll need to do more of a functional approach, and you'll get patients with cancer and sleep disorders and autoimmune diseases and brain issues, etc. But yes, if you're asking me, I would definitely do at least modules 1, 3, and 5 before I opened a practice in this field of endeavor. And remember, you have support, okay? You have webinars. We do 1 to 4 webinars a week. You can always ask questions, and we have Ask the Professor Day twice a month as well. If there's an emergency question, we can take that on a daily basis if needed, okay?
All right, I think that's it for now.
Okay, on to the next slide. You want to find something that is unique to specialize in, okay, that is going to be your area of specialty. Like in my practice, one of our partners does aesthetics. One of our partners does ADD, and she's a Dan doctor, etc. Okay? One of our other partners does IV therapies and chelation. I obviously specialize in hormones, as we all do, but now we're taking up the idea of brain fitness, where we are going to specialize in maintaining memory. Obviously, if people have memory loss, we will help them, but our goal really is to be proactive and prevent memory loss. So it's a brain fitness program. So everybody, all my partners are required now to take Module 15, A through D. So in New Orleans this fall is going to be A. In December is going to be B, and then next year is going to be C and D. We're all going to be actually getting the certificate from the University of South Florida College of Medicine, including myself, so we can have that little plaque on the wall that says we are certified by USF to do brain fitness. We've actually hired some time on WJR radio in Detroit, which is the #1 radio for the income demographics that we want to hit. We're going to be doing an hour interview, and then we're going to be having repeated hits to our websites, Twitter, etc., and then more interviews when we launch our new program on brain fitness. I absolutely encourage everybody to consider doing this. It's a great, unique area to specialize in. And I just realized I spelled specialize wrong on here, sorry. It's a great area to specialize in because it's going to be the biggest issue in medicine in the next 30 years. It's going to be all about whether you maintain memory. Absolutely, positively, without a doubt. Does that require hormones? Yes. Does that require heart health? Yes. Does that require toxins not to be there? Yes. Does it matter if the person exercises and eats well and all of that? Absolutely. But that's going to be the big issue. Now, just so that all of you do know, and you'll be getting a notice on this, if you decide to do the brain fitness modules and you sign up for all 4 of them, then you will be getting, as we go along and we do each module, you'll be getting the same advertising that I'm going to be using personally in my practice that myself and my partners are developing. So you'll be getting an actual seminars to give to the public that are PowerPoint. You're going to be given seminars to give to physicians, grand rounds, etc. We're going to be developing brochures, flyers, all those kind of things. It's something new we're doing in the fellowship. And this is centered around modules 15A through D, and we're going to try and see if that helps everybody grow a practice. So for those of you who are interested, that's modules 15A through D. Call your A4M rep and sign up for this. A is really going to be interesting, looking at hormones, and David Hasse does some absolutely fabulous seminars looking at how the brain works and EEG, and there's just phenomenal speakers. Module B in December is taught by 4 Harvard professors, and the 4 Harvard professors are going to basically go over conventional treatment, because you need to know conventional to be good at this, but they're also going to teach everybody how you test for memory. You know, what are the tests you actually do? And they're going to give out their own test. They have their own textbook. There's going to be breakout sessions. It's going to be phenomenal. So find an area, whether it's weight loss or advanced cardiovascular health or lifestyle coaching or sports medicine or advanced endocrinology. You know, we offer a lot of certifications. Look at specializing in an area to get people's attention. Once people start coming in, then you'll use everything you use in the fellowship anyway. I never intended to have a cancer practice, but I do, because people started coming because, oh, well, she knows something about how the gut works and a little bit about how you eat, and sugar feeds cancer. So find something that's unique that people will gravitate to you, that education matters. It really does. It will be very, very important to you as to what education you have. For example, I was giving a talk in my own area for a group of people that hired me to speak. And they said, somebody from the audience piped up and said, oh, I see Dr. So-and-so as my anti-aging doctor. And I said, oh, that's really, really great. And the person said, well, that person doesn't do saliva testing. I thought, okay, that's not a fellowship-trained doctor. So you never criticize another doc. All I did is said to the person, you know what, education is really, really important. It doesn't matter what specialty you're talking about, whether you're talking about cardiology or anything else. Always make sure that the person that you're seeing is fellowship trained, advanced fellowship trained, has a master's degree in this field. That person, I heard later, went back, called the doctor she was seeing, and of course that doctor said, well, I've only taken a weekend course, and we got that person in our practice. Because it does matter. In my personal draw area, there's 465 doctors that do bioidentical hormones. It's really hard to get in to see any of us because, again, all of us are fellowship trained, advanced fellowship trained, and all of us will be through the master's program at some point. I've already finished it, as will the rest of my partners. As soon as people realize you're advanced trained in this area, it brings people to you, particularly educated people and the people with the demographics that can afford our services. Eventually, I hope everybody can. If I win a lotto, I'm going to open up a free practice. But at this point in time, I have to feed my family like you all do. But education is a really good marketing technique. So any questions looking at specialization or education?
I have a couple submitted about various topics.
Sure.
So 2 of them are kind of similar, so I'll lump them together. How much time do you spend with a new patient versus a follow-up visit? How long are initial visits?
My initial visits are usually 45 minutes. I schedule an hour just in case I run over, but I usually use that for paperwork. I've discovered after my initial visit, if I spend more than 45 minutes with a patient, I'm really becoming their psychiatrist. I'm not a shrink. And, you know, I'm going to need a shrink if I spend too long with them, because at some point you take on their problems and you want to empathize, but you don't want to get drug into their problems. Okay? So, again, about 45 minutes. The exception to that is my cancer patients. I do schedule an hour and a half for a new one because they do take longer. My follow-up patients are traditionally a half an hour. So what I usually do is I schedule someone for the first visit. Some of you order labs ahead of time. I never do that for two reasons. If I order things ahead of time, that decreases one visit the patient will see me. It's not a good business technique. Also, if I order things ahead of time, then it doesn't convince people that I'm personalized medicine. How would I know what to order if I've never met you? So the patient comes in to see me. We do the history. I don't do their entire physical. I ask them to bring it with them from another doctor. I may touch their thyroid and examine it, etc. But in my personal practice, I don't do their physical. If I did, it would have to take an hour and a half to 2 hours. Then I bring them back to go over their lab results. That would be a follow-up visit of a half an hour. You can't fix everything at one time. The body gets confused and the patient gets confused. So let's say on the second office visit I prescribed hormones for the patient. When you prescribe hormones, you always want to bring somebody back in 90 days and then every 6 months thereafter. I might bring them back sooner if I'm going to deal with thyroid. Remember, you have to fix adrenals first and then thyroid. I will bring them back for a separate visit if they have insulin resistance, etc. That's a whole different problem. A separate visit is gut. So typically, a patient in the first year may see me 4 times, and then usually they see me probably twice, maybe 3 times a year thereafter. Okay?
All right, we have a couple more pertaining to health coaching. One is wondering how much a health coach typically gets paid, and do you personally have a full-time health coach?
I do not have a full-time health coach in my practice because actually I enjoy that aspect myself to encourage the patient. So part of it is, you know, what is your personality, etc. Under the Affordable Care Act, there is a provision for a health coach, but that would be someone that would be trained in lifestyle health coaching. And that's part of the reason that we offer lifestyle health coaching in the fellowship. It's 4 modules. If I were going to have a lifestyle health coach in my practice, would I put them through the 4 modules? I would. I put my PA through the entire fellowship, advanced fellowship, and I put her through the weight loss certification because that's her area of expertise. So if I were going to do lifestyle health coaching, I would want to make sure my person is very, very well trained and they're actually certified to do that, because then it's billable if you're going to bill.
Okay, this last question does pertain to the lifestyle coaching certification that you just mentioned. It says there's not been a corresponding class at USF for the lifestyle coaching certification in a while. Are they still offering this program?
They're still offering this program. We do have to get to enough people to offer it again. So you can take it online, and then you would wait until the course came up. If we have enough people, we're willing to offer it the next time we give courses, and that would be in September. We're just waiting for enough people.
And this question says, can a non-medical person get the lifestyle coaching certification?
Yes, that's a great question. All these are great questions. In fact, in our first class of lifestyle health coaches, there was probably 30% of people that did not come from a medical background. It's a great new career for someone, for example, that was a teacher or a social worker, or perhaps, you know, a mother who stayed at home and had an undergraduate degree in really any area, or he had an undergraduate degree in any area and wants to change fields, or perhaps someone who lost their job and wants to change fields. So yes, about 30% of our people did not come from what you would call a traditional medical background.
Okay, and This question says, if you identify multiple problems with a patient, do you start with adrenals and ignore the hot flashes until they come back to discuss the cortisol levels?
Actually, I usually do the hormones of adrenals, meaning DHEA and cortisol, at the same time I do the male or female hormones. I would not do thyroid at the same time. So, for example, if a woman came in to see me with hot flashes, obviously her hot flashes could come from estrogen loss or estrogen changing, or it can come from adrenals, but I am treating them at the same time. So if she was low in estrogen, I would give her some Biest, give her progesterone if she's low, DHEA, or I would give her testosterone. And then I would have her do 4 things for abnormal cortisol: stress reduction technique, multivitamin. Commonly, I give calming herbs because many of my patients are stressed and wired. And I would also give adaptogenic herbs, ashwagandha, rhodiola, ginseng, one of those. But I would do all of that in one visit. If the patient also had a thyroid problem, I would bring them back in about 6 weeks. If they also had weight or a blood sugar issue, etc., then I would wait 4 to 6 weeks before I brought them back. But I would still bring them back yet again 6 weeks later for that repeat hormone level. So could they, in a 4-month period of time, have had 4 office visits? Yes, initially, depending on what their issues are. My newest 3 patients into my practice all came in for weight control. And one of them had seen, as I said earlier, an anti-aging physician. One of them is an anti-aging physician and brought in his wife. And they're all 3 new to my practice, all came in for weight as an overriding problem. But as you know, weight's multifactorial. You have to start somewhere, but again, you can't fix it all. Would you start with hormones commonly? But could I have started with allergies or gut or detox? I could have started with any of those, but just one at a time.
That's all our questions for right now.
Try and do something for the patient that ties them to you permanently. Okay? Let me give you some examples what I mean when I say that. Because I don't take insurance in my practice, probably 15% of people who see me think they come in and, oh, I'm going to get that golden prescription for hormones, or she's going to detox me or fix my gut, and then I won't need to see her again. I can do all this with my primary care doctor who takes insurance. My mistake was not tying that patient to me permanently. Okay? Yes, I will still lose some patients. Every doctor does. But now I permanently tie people to me. Okay? We can do that through the new computer program that we have to offer at A4M. We can put the patient into the computer system. They'll have the computer portal. That system's available in the next 4 weeks. And the patient will have their own portal which ties them to me permanently. I can put them on customized vitamins. It is a prescription written by me from Custom Vite. They have to go through me to get it. It's tax deductible because they can pay for it with a medical savings account. It ties them to me personally. I invite their family to become involved. That ties them to me personally. Find a way that that patient consistently is tied to you. And the new portal system is going to be great because you can actually charge the patient to be tied to every month. And it's up to you as to what you want to charge, $15 a month or whatever to be involved in all of this. But that's another resource for you into your practice that someone's paying you. But find a way to tie that patient to you on a regular basis, one way or the other. For example, weight loss. Studies have shown that patients do better for a weight loss program if weekly they come in. So depending on your kind of practice, you might want to see them individually weekly. I have some patients like that. We also offer group visits for weight loss. It's cheaper for the patient, but they also encourage each other to lose weight, and the studies have shown people actually do better in group visits for weight loss. They come in every week. It ties them to us. Once they've gotten their goal weight, then they come every other week. Eventually they come once a month. But many of those patients come to a group meeting at least once a month. Also, new on the horizon, you have to see, what people are paying for now. Beside brain fitness, another source that if you're going to go through insurance, it's really a good source of income for you is addiction medicine. There's a lot of things that we offer in addiction medicine that no one else does. And we are very, very successful. Our professors like Elizabeth Stuhler, Hyla Cass, some of our professors have really dynamic addiction practices. In fact, one of my friends who ran an addiction practice, he actually started it with a physician, he's not a doc, just sold his addiction clinics for $40 million, $40 million. He just turned up and sold them all and decided to retire out and move to the Caribbean. It is an area that addiction is going to be around forever. It's a big area of growth, and we offer unique things that no one else does. That's another certification is addiction medicine. It's not too late to be involved. We already did Module A. You can take that online, and then you can take B, C, and D online or in person. But you'll find it phenomenal. There's a lot of really innovative therapies that we offer that no one else does to make us really successful. Again, addiction medicine would be tying the patient to you, okay? Important to do that. Plus, let's face it, if the patient's really happy, they had an addiction, whether it was food or the TV set or alcohol, drugs or whatever, they tell everybody. And then you have more and more people. So again, find something unique to specialize in and then work with something to tie that patient to you so they never leave you. Questions?
There is one about a patient portal. It says, can you tell us more about this computer software with the patient portal? How does it work and where do we get it?
We're going to be doing a demo on that very shortly on how to do it. The patient portal part that I'm really excited about is the one for weight loss and healthy eating. It is just very robust, very dynamic, and all of that's going to be rolled out right into the fall here as soon as everybody gets back from vacation. So you'll all be getting a notice. So watch for notices from your A4M reps and from me personally. Okay, I hope you all got the notice that I sent out that Dr. Khan and his group did on niacin. And really the question that was going on with niacin, should we give our patients niacin? So always watch for those. Though the subject will say from Dr. Pam Smith. Okay, that's me to you personally. Those commonly have medical things in them as well. I will also make the announcement on the portal personally myself along with A4M as well.
That's all our questions for right now.
Okay, we'll move on to the next slide as I drink my water here and stay healthy. Giving seminars is still, hands down, the best practice builder there is. Okay, some of you have taken Module 5 and have heard me tell the story of a seminar that I was giving along with a book signing at my best friend's quilting shop. My best friend owned a quilting shop. Unfortunately, my friend has passed away at this point. But when my first book came out in 2003, she said, do you want to do a book signing and a lecture? She goes, come to the quilting shop. We're running a sale. It's end of the year sale. Women will come, and remember, women purchase health care. Okay, most health care is purchased by women. Men come because the women in their lives, their daughters, their wives, their significant others, their secretaries, their mothers, they send them in. Okay, so I said, sure, I would love to do this. Worst ice storm in 100 years in metropolitan Detroit. 2 people came. One of them owned 5 home health care stores. She put my books in her healthcare stores. Not only did she do that, she put flyers in there for my practice, and I even opened up one of my offices inside her largest store, and she didn't even charge me rent. There was no kickback situation there. There was no Stark Law violation because, you know, we weren't sharing sales of anything. And so my first year in my second office actually didn't pay rent at all because of that person that happened to come to a seminar that I was giving. It's not always about the number of people that come. In my first office, I gave a seminar every single Tuesday night like clockwork for a year. Didn't matter how many people came, I gave a seminar every Tuesday night. Eventually, I stopped them for a while because I got what you call groupies. They would just come and they would get information and they would never become patients. And I would stop calling on them in the middle of the seminar because I could see they were there every week, but they were never going to come in and see me. The trick to giving a seminar is several things. First trick number one, when you give a seminar, don't give too much information. If you give them too much information, they think they never need to see you. Okay? So don't give too much. Just whet their appetite. Then they will come in and see you. They'll go, oh my gosh, I haven't had my hormones measured. I don't know what saliva testing is. Well, I didn't know that phosphatidylserine was a nutrient. That's that thing they call PS. That's for my memory. Well, how grand is that? Tie them to you by coming in. In the early days, we had one of our professors, actually Roxanne Kafora, asked me to come out to Long Island and do a talk for her when she opened her practice. And Roxanne did the coolest thing I'd never seen done before. She brought her staff. When I got done speaking, we did a book signing, and right next to my book signing, she was making appointments for patients right then and there. 70% of the people who came to the seminar made an appointment right there. I'd never seen anybody actually have somebody, okay, we'll register you right now to become a patient. It was a phenomenally good idea by Dr. Kafora. So be innovative, but give seminars. When you first start out giving a seminar, use PowerPoint if you need to. For those of you who are more adept at giving seminars, in Module 5, we give you a lot of handouts that you can use just a handout for the seminar. When you do that, make sure you put your name on the handout. What I suggest to you is you never give anybody a copy of your PowerPoint. Okay? Copyright everything you do. Never give anybody a copy of the actual PowerPoint. Just give them a handout pertaining to it with your practice name on it, your name, and your contact information for them to make an appointment. People want this kind of medicine. And right now when I'm out giving seminars, my big topic is memory. Every seminar I give now is sold out. Yours will be too, because people are interested in maintaining memory. Find something they're interested in. We just did the Thyroid Summit. For those of you who attended the Thyroid Summit, 1 million people now have come online at this Thyroid Summit that Dr. Brownstein, myself, and other people participated in. Get involved in putting on your website. If you're looking for thyroid, because it's a hot topic right now, come to my thyroid seminar. Tip number 2, have someone pay for the seminar for you. I call my friendly compounding pharmacist and say, hey, I'd like to give a seminar. Would you like to sponsor it, please? My compounding pharmacies do, and I work with 11 of them. They're all great PCCA compounding pharmacies. And I don't work with any pharmacists that are not PCCA because they use the best hormones and the best bases and best nutrients. But my compounders pay for my advertising. They pay for the location that it's going to be at. So there's no out-of-pocket cost to me except for my time. The other trick in giving a seminar, tip number 3, is to charge for it. I did initially a mistake. If you don't charge at least $10, people don't think it's a value to come to the seminar. So charge at least $10. That way you can pay for the facility you're in if your compounder is not paying for it. And be innovative. You may want to ask if you do a lot of testing with a particular company, like Genova or SpectraCell or any of the companies that you might do a lot of testing with. If you use them a lot, ask them to be part of your sponsors when you give a talk. Be innovative. Try not to pay out of pocket yourself. But once you get in front of people and you explain what you do, people want what you have. And they will invariably say, why doesn't my doctor do this? Never criticize their doctor. Just say, well, I'm a specialist in this field, and I'm sure you have a very good primary care physician, and I want to work with them in order to help you be healthy and stay healthy. Okay? So giving seminars a real key. Questions?
Not at this time. I don't see any. Oh, here's one. Can you explain more about the custom bite thing you mentioned and how to get involved?
Yes.
Is there a cutoff time for joining the addiction and brain health?
Absolutely. There's plenty of time to do all of this. And since you guys are all kind enough to be here tonight, okay, what I'm going to do is give you my personal email. Do not abuse it. Okay, it's not for patient questions, but I'm going to give you my personal email, okay, and I want you to email me if you want to be involved in addiction. If you want to be involved in brain fitness, then email me, okay. If you want to look at some of these other ideas, then please email me, okay. My email is pepper, P-E-P-P-E-R, the number 4, at S as in Sam, B as in boy, C as in Charlie, global.net. So Pepper, P-E-P-P-E-R, the number 4, at S as in Sam, B as in boy, C as in Charlie, global.net. Now if you email me a patient question, I will just say, please send this to Ask the Professor Day. This is for people that may have more questions about what we're talking about here tonight, with being involved in addiction, being involved in brain fitness, and just really looking at some different ideas to grow your practice, books wholesale, anything you want to do that we can do to help you grow. Okay? Was there another part of that question, Jordan, I didn't answer?
There was a question. Can you explain more about the custom bite thing you mentioned and how to get involved?
If you email me, then I'll put you directly in touch with Custom Vite. They're a corporation, and then they can work with you and sign you up. Basically, it's a questionnaire that goes to all your patients that you want to look at an actual customized vitamin program. And Custom Vite, the company, will take the patient's labs, any of the labs you do, amino acids, fatty acids, anything. They'll take a master's degree nutritionist, develop a customized vitamin program for that patient, and they'll send you the formulation. Then it is a prescription. I sign off on it, so it qualifies for a medical savings account. They can pay for it with pre-tax dollars. You can change it if you want to. If you're not good at doing this at first, you might want to just accept what they send you. You can add other things later on as you get better at this. But having done this now for 10 years, I can tell you that about 90 to 95% of the time, what they send back to me does not need altering. But because it is an actual prescription, it ties the patient to me. Plus, they send me a check every month. I get 25% of the profit margin. And that doesn't mean I don't use other companies like Metagenics and Designs for Health and Orthomolecular and Biotics and all these other companies. I do. I use all those Nordic Naturals and more. But I also use customized vitamins because it ties the patient to me. It goes directly to the patient's house. I don't have to fill it myself and send it out. It qualifies for a medical savings account, as can Metagenics products, etc. If you fill out a medical necessity form, and that form is in Module 5. If you need that form, then email me. I'll have one of my staff send you the form if you haven't taken 5 yet, and so that other companies can qualify for that as well. But it comes right to them. It's a packet they take throughout the day, and it really is made for them and them only and no one else. Okay? Any other questions?
There was one more question. Is there a potential market in tying in an occupational health practice?
Absolutely. In fact, my master's in public health is in occupational medicine and toxicology. And you can absolutely do that. You can approach the hospital that you work for and actually offer to be their doctor that does occupational medicine. Excuse me. You can approach companies and basically say that you have a special program for their executives, etc., and describe the program to them, develop a little PowerPoint, go and present it absolutely for this. And we do in our practice function in that manner for one hospital and for a couple of different companies.
All right, we have no more questions at this time.
Okay. Well, that was the end of the slides. I hope this is helpful for you to look at the idea of transitioning your practice from conventional medicine. Just remember that you do not want to mix practices between conventional and otherwise. You want to always encourage your patient. Watch your overhead. Make sure that you have something that's unique to your practice. Make sure that you have something that is a specialty to you. Make sure you tie that patient to you, giving seminars, etc. All of these are really good ways to transition your practice and also grow your practice as well.
Dr. Smith, if you could repeat your email address one more time, I think that would be helpful.
Yes, pepper, like the spice, P-E-P-P-E-R, the number 4, at S as in Sam, B as in boy, C as in Charlie, global, global.net.
All right, thank you so much, Dr. Smith, for your time. This was an excellent presentation. I thank everyone who attended for their time. We hope you enjoyed this webinar. A recording of this webinar will be available and distributed to all registrants via email. If you have any questions about any of the information presented tonight or about A4M events or the education modules discussed, please visit a4m.com or call your educational advisor today at 888-997-0112. Again, thank you for Dr. Smith. Thank you so much for your time, and thank you everyone for attending, and have a great evening.
Thanks, Jordan.
Bye-bye.
Bye-bye.